My name is Bantu Campbell. I'm also from St. Vincent the Grenadines, working at the ECCB. Okay, so I was listening to your lecture, which I think was very insightful, but I wanted you to expand on the focus on the 40%, because just permit me to be devil's advocate. If there were 20 persons in a room, 10 billionaires, 10 millionaires, the 10 millionaires would be in the bottom 40, but that's not necessarily indicative of a crisis situation. And no matter what initiative you do, there will always be a bottom 40%. So would they look at how much percent is below the poverty line or standard of living as opposed to just a blanket 40%? So if you could expand on that, just for my understanding.
Okay, so that's a very good question. So that's drawing heavily on Amartya Sen's work, and he has this notion that, poverty is not an absolute concept. So you sort of draw a poverty line, but somebody who feels poor in one society, at the same level of income, they don't necessarily feel poor in a different society. So Sen has this notion that poverty is really is a relative and not absolute concept. So do you have the resources to access, for want of a better term, the good or decent life in the society in which you live? So somebody in the bottom, but that person at the bottom 10% in the United States feels disadvantaged. They are disgruntled. They're not socially engaged. They are not able to engage the United States society as a normal, fully integrated citizen. So that's one aspect behind it. And as I said, I'm fuzzy about that because we don't know a lot. So maybe when we study that bottom 40%, they're fine. They're not a problem. They're living good, normal lives, and we don't need to bother about it. But I do have the suspicion that if we were to have the data to do that type of Lorentz-type curve across the Caribbean, we might see that we have quite a skewed distribution, and that is basically struggling to cope at an everyday level in terms of what is seen as normal life in that society. So I think something we need to find out more about, because I'm still grappling with why does a place like Barbados have such a high crime rate? When I look at labor force participation rates, again, these things are all declining, suggesting that there is some increasing degree of marginalization. But I'm agnostic on it. I'm open-minded on it. But I think it's something we need to delve into a lot more, because we are making a lot of policy without really an understanding of that income distribution.
You spoke about quite a few things, but I want to know, how would you factor in these three things: trade, health, and social safety nets? Just those three.
And so a lot of what I'm thinking about, so let me start with social safety net. Caribbean societies, on the surface, we invest quite a lot in our safety nets. There's a lot of access to education. There's a lot of access to health. And I think the safety nets that we have in place, I think, are a major factor why we tend to score that high on the human development index. So when I think of the social safety net, it's there, but how effective is it? And I think that goes to the heart of what I was speaking about in terms of education, healthcare. We have these safety nets in place, but what is the quality of the service? So I operate in Antigua, and there is a lot of investment in public healthcare, but it's also very clear to me that the mindset in Antigua is, if I get sick, I want to get on a plane to Miami. So you have you have a healthcare system. What are the outcomes? Despite this investment, we still have this NCD crisis. So the safety net is there. I think it's important, but I'm very keen on to what are the outcomes? What is the quality? Because it's a lot of investment. Health, I think, is critical. I guess I kind of lumped the health and the education together as similar issues. Again, The health I see as critical with that CCC crisis. It's clear that we are investing a lot in human capital, but because of this chronic disease crisis, there's significant morbidity and mortality, which really erodes the return we get from that investment. We have a lot of lost sick days, persons dying early from these diseases, and just the cost of care. So, for example, in Barbados, governments get judged a lot on the quality of healthcare. And the public complains a lot about the quality. And my colleagues in the medical field say, the hospital is just drowning under the NCD crisis. It was not designed for managing persons on a significant number of persons for 15, 20 years on dialysis and so on. So with the safety net and the healthcare, my focus really is on the quality and the outcomes. I think we've done a good job in providing the access, but what is the accountability of these systems? What is the quality that we are getting for that significant investment? Trade, well, again, trade is just part of our lives. As an island nation, small island nation, one has to trade, so I didn't really delve too much into that trade aspect because I sort of take that as a given, and it's not my expertise anyway.
Yes, thanks. You had a slide about the number of years it took to rebound from a recession or some sort of economic crisis. And of course, it showed that the small island states take a very long time. I'm wondering what are the possible big, maybe three things that we could do to reduce that time to recover, given, of course, our small size, etc.
Yes, sir. I guess if I had the answer to that, I'd be like Arthur Lewis collecting my Nobel Prize. But my own thesis, which I've argued in some of my published work, is that because of the fiscal indiscipline, because we don't have the fiscal buffers, when the shocks hit our small island developing states, the budget is already in a bad state. So the states do not have the capacity to engage in sort of your standard basic economic counter-cyclical fiscal policy. The shock pushes you into recession, the state then steps in. But the state doesn't have that capacity. In fact, in many states, because it's an external shock, which affects your foreign exchange earnings, countries then face Forex balance of payments crises. They're then going into structural adjustment programs, whether homemade or from the IMF, which then calls for further fiscal restraint. So because of the fiscal weaknesses, at the precise point when the state should be spending money to jumpstart the economy, the state has to pull back. And I think that's a major factor in why our recessions are deeper and we take longer to bounce back, because on top of the external shock, you now have the fiscal adjustment to deal with, which is really dampening growth. I had a slide on it initially, and then I took it out because I didn't want to sound too wishy-washy on it, but because it's really the big holy grail. How do we have some more economic diversification? How do we reduce reliance on the single sector? And I think the gentleman who spoke first maybe in a way alluded to that. What sort of economy you want to build? But I tend to think that diversification is a whole lecture in it, because it's something we are aware of. We know it. There's been a lot of discussion, but moving to a more diversified type of economy with your limited space and resources and so on. So my own view is that tourism will and should remain important, but tourism should become less important in a relative but not an absolute sense by the emergence of new sectors. I think the investment in renewable energy has the potential to give us a sector that is home-based, that is saving foreign exchange. So I see that as a critical element of the diversification. And I hope I have given you a half-decent answer.
Good evening, Stephanie Pascal, Dominican, junior economist here at the ECCB. My question has to do with the policy suggestion in regards to universal education, early childhood education. You gave this staggering statistic about CXE with the pass rates. And when we really look at what has happened throughout our countries, we would say, and you agreed as well, you would say we have made access much more widely available. So why then are you proposing to create more access, as we are seeing that the results are declining compared to looking at curriculum restructuring, looking at better strategies? So just expound on that as to why you chose more access compared to other strategies.
Okay, so yes, good question. So I suppose as a little boy in St. Vincent, going to the Grenadines a lot, and when the boats break down, you can't stop in the middle of the ocean. So there was a saying that you have to fix and sail at the same time. So I think we have to address the outcome deficiencies in our primary and secondary school system. But at the same time, we also have to invest in providing that access for early childhood education, because it's one area of access that we have not really gone into across the board. We have really focused on the primary and secondary, but there's just too much evidence coming out in terms of research in education that those first 3-4 years are just quite critical in brain formation, discipline, how you actually succeed in the education system. If we don't have intervention at this stage, then a lot of the investment at the higher level might not give you the returns. And those early years are sometimes where poverty, unstable households, etc., where there is the greatest impact. So you have someone who is a low-level worker in a hotel, and we were talking earlier, they are working the graveyard shift. Who's taking care of their kids when they're doing all of that? I mean, unless somebody asked about the bottom 40%, and I'm not always clear that when we are making policy, we really have an understanding of lives and what are the challenges there. So I see the early childhood intervention as just critical because of the evidence. And if you don't have that base, then the investment at a higher level, you're not going to get the returns.